I feel like this might be the last update for real this time. I feel as good, if not better, than I did 8 years ago before I got ill. It's possible, guys. A lot of you have been waiting for this video where I explain everything that I have tried for chronic fatigue syndrome / myalgic encephalomyelitis, which from now on I'm just gonna say ME/CFS or just ME. If you've seen in my previous video, which is very long, I was pretty much sharing my experience with IV therapies, hydrogen peroxide IV and ozone IV. I'm going to be talking about those again today in minor detail. There's a lot of information that I want to add, and I don't want this to be an hour long again, so I'm going to try to condense this as much as possible without leaving out too much information. Before we start, I want to mention that I do have a background in health sciences, but I'm in no way a doctor, so all of this information is my own research and my own experiences with what I've tried. So this video is going to consist of a few different parts. I have a list here because there's a lot of stuff I don't want to forget. So we're going to talk about signs and symptoms, which symptoms have changed for me, what has completely gone away, what is still kind of there. As I mentioned in my last video, I'm about 95 to 99% better now. It still fluctuates. We're going to talk about some potential causes of ME/CFS. We're going to talk about more common treatments such as pharmaceuticals, the PACE trial. Then we're going to get into supplements, and then finally IV therapies. Alright, let's talk about signs and symptoms. If you're watching this, you probably have ME/CFS, so you know all about the signs and symptoms. The official Canadian Diagnostic Consensus lists that the patient must have fatigue, post-exertional malaise, sleep dysfunction, pain, and a minimum of 2 neurological and cognitive symptoms, which can include confusion, impaired concentration, memory loss, difficulty with information processing, word retrieval, sensory disturbances, ataxia, muscle weakness, muscle fasciculations, and must have a minimum of 1 each of autonomic, neuroendocrine, and immunological categories. So autonomic category would include orthostatic intolerance, lightheadedness, pallor, nausea, irritable bowel syndrome, urinary frequency, heart palpitations, exertional dyspnea. Neuroendocrine category includes thermostatic instability, sweating episodes, especially night sweats, feverish, cold extremities, intolerance of extreme temperature, weight change. And immunological category includes tender lymph nodes, recurrent sore throat, recurrent flu-like symptoms, general malaise, food sensitivities, chemical sensitivities, and it has to have lasted for at least 6 months to be chronic. I don't know why I did this. I'm going to list the symptoms here that I had, and now these are the ones that I have now that I'm almost completely better. As you can see, there's still a few that linger a little bit, but it's definitely improved drastically. My memory has gotten slightly better. There's still some times where it's not the greatest, but I'm hoping that's going to keep improving with time. I can sleep a little bit better. A lot of the time I wake up feeling rested. I don't feel the need to nap in the daytime anymore. I've had a huge change in muscle pain. I hardly have any kind of muscle pain anymore. So what causes ME/CFS? The thing is, no one really knows as of right now, but there's a significantly high rate of Epstein-Barr virus / human herpes virus 4 in patients with ME. This is responsible for mono and glandular fever. Now, not everyone will have it or has had mono or glandular fever before. For me personally, I did get mono in 2011, and I do equate that to being ill all this time. I was completely fine before then. There's also research showing variations in pro-inflammatory cytokines, so there's more inflammation throughout the body. It's also been found that there's overactive B cells, which are white blood cells that produce antibodies. So basically, your body is constantly trying to fight something. There's also a decrease in the function of natural killer cells, or NK cells. NK cells are white blood cells that control viral infections. So for some reason, that's not working properly. And if it is a viral issue, like with Epstein-Barr virus, then that could make sense why it's still reoccurring, because our body's not getting rid of it like it's supposed to. Of course, there's ATP depletion. ATP is basically the energy unit of our body. We don't make enough ATP. And there's a supplement that'll help with that, and I'll get to that later. One last thing is that we have a lower anaerobic threshold. So with anaerobic respiration, we convert glucose, which is like sugars, into energy, and a byproduct of that is lactic acid. So people with ME produce more lactic acid, and it's actually been found in some studies that people with ME have more lactic acid surrounding the brain.
Okay guys, so I didn't explain it very well. I'm going to use this visual to see if I can explain it a little bit better. So we have two types of respiration, cell respiration. We have aerobic and we have anaerobic. Aerobic respiration is the most common. We take glucose and oxygen and we turn that into energy, and it creates a byproduct of CO2, which is carbon dioxide, and H2O, which is water. Now, we get rid of the CO2 by breathing. This is what we breathe out of our lungs. And the H2O, which is water, we get rid of that through sweating. This creates 36 units of ATP. Now, if we look at anaerobic respiration, we're using mostly glucose because we don't have enough oxygen. This creates a byproduct of lactic acid and only creates 2 units of ATP, so that's not a lot. Let's take a look at a quote-unquote healthy individual, or someone that doesn't have ME/CFS. So let's say they're doing some sort of exercise. Their aerobic respiration will be quite high. They're able to do this exercise quite easily, but near the end of the exercise, they're starting to get a bit tired. They're running out of oxygen, so they're breathing a bit deeper. This is our anaerobic respiration at the end. Now let's look at someone with ME. You'll see that their aerobic respiration is quite short and their anaerobic respiration is quite long. People with ME have a lower anaerobic threshold, meaning they reach an anaerobic respiration lower or sooner than quote-unquote healthy people. Healthy people have more aerobic respiration, so they're producing a lot more energy. But people with ME, they have more anaerobic respiration, so they're not producing a lot of energy, but they do produce a lot more of a lactic acid byproduct.
As far as pharmaceutical treatments go, there's nothing specifically for ME, and there's nothing really regulated as of right now. There was Ampligen, and that was one of the major ones that people were hoping was going to be approved for ME. It was originally created as a cancer drug, and they thought maybe it would work for people with ME. It changes your immune system, and it has some antiviral properties. It's supposed to increase the natural killer cell function and increase the production of tumor necrosis factor, which basically kills tumors. That's why it was a cancer drug. They started researching Ampligen for ME in the 1990s, but it still hasn't been approved, and so far the studies are looking not too promising. Then there was rituximab, which was for rheumatoid arthritis and cancers again. It was to decrease B cells, so you basically suppress your immune system. And it's supposed to work for autoimmunities, but as of April 2019, they found that it was not helpful for ME. So that has been scratched out. Now, there are lots and lots of different pharmaceutical drugs that someone could take for ME, but none of them are to specifically cure it or to fix the cause of ME. Now, you could take painkillers, anti-inflammatories, antivirals, nerve blockers, none of which that I personally take. For me personally, I don't take pharmaceuticals unless completely necessary, like antibiotics, because I find that pharmaceuticals tend to have a lot of side effects. If it's not directly targeting the cause of ME, for me it's not worth it. But it doesn't mean that it's not worth it for you. There are options though, so check with your doctor. Let's talk about the PACE trial. There was this huge trial for ME quite recently, over the last couple years, and it consisted of two major treatments. One was cognitive behavioral therapy, and the other was graded exercise therapy. Now, the reason why this had so much backlash is because a lot of people with ME are often told that this is a psychological issue, that they're making it up, and it's all in their head. That's why cognitive behavioral therapy was so pushed back against, because it made people feel like it's not a real physical condition. Fortunately, this whole study was discredited because it altered its findings, which is complete fraudulent activity. However, cognitive behavioral therapy and graded exercise therapy do have components that are actually helpful for people with chronic pain. Here's why. Gradual symptom-free exercise is good for increasing your lung capacity. It's good for your cardiovascular health, it's good for your muscle mass, your bone mass, and it increases oxygen levels in your body. The problem is you have to stop the exercise before you crash. Now, with graded exercise therapy, it's usually one prescription fits all. People with ME vary from completely bedridden to completely functional. You have to go off of your own body, and you have to listen to your own body, and what you can do today might not be what you can do tomorrow. You just take it day by day. If you can only stand up for a couple minutes without getting lightheaded or hard to breathe, then that's all you do for that day. Don't push it. Be patient. And about cognitive behavioral therapy. Although ME is not a psychological condition, does not mean that it does not affect your mental health. Besides, cognitive behavioral therapy is not just for mental health or for psychological issues. It actually trains your brain in how to cope with pain. There's 4 components to cognitive behavioral therapy specifically for pain. There's the pain itself, there's thoughts, there's feelings, and there's behaviors. Now, sometimes you can't control pain, or oftentimes you can't control pain, but you can control your thoughts, which affect your behaviors and your feelings. I'll try to put a diagram that explains what I'm trying to talk about, but basically when you're in pain, you'll think, I'll never get better. Then you start feeling depressed, hopeless, unencouraged, and then your behaviors might be avoiding activities. Another way to look at this is snowballing. So it might start as something small, and the way you behave and think and feel about it can snowball into something bigger than what it originally was. So let's say you start with brain fog, then you start stressing about crashing, and then you're triggering thoughts of hopelessness. You start withdrawing from activities that bring you joy. You fear that you're burdening your family or your partner, so you isolate yourself from supportive people or groups. Then you start feeling really depressed about your health because of how it's affected your life. Then you start slacking on self-care because of your depression. And then you end up worsening your crashes because you're not taking care of yourself or eating right or taking your vitamins. So you can see how something small like brain fog can spiral or snowball into something much bigger. Now, this is not something that can happen right away, but with time and with practice, it is possible to help control and reduce your symptoms and the severity of the pain simply by being aware of your thought patterns about it. This is not at all to say that the pain is in your brain, because it's very much real and it's very much happening physically in your body, but your brain can intensify that pain, which is physical pain. It's not psychological. I know I'm gonna get a lot of backlash for this, so I hope that I explained it right. Okay, now let's talk about some fun stuff. Supplements. A lot of people don't want to take supplements for some reason. A lot of people think that supplements don't work. I've tried many supplements and I can honestly say what's worked and what hasn't worked for me personally. But the ones that I've picked out to share with you, I think would probably work for most people. Of course, this is not medical advice. Consult your doctor, naturopath, nutritionist, whoever you want to see. I have a list of 8 supplements that were the most helpful for me. Number 1 on that list is CoQ10 or coenzyme Q10. This helps your mitochondria produce ATP. You can generally take anywhere between 200 milligrams to 600 milligrams. It's better to start small and work your way to a larger dose. CoQ10 is found naturally in the energy-making areas of the body, most prevalent in the heart, but also in the liver and the kidneys. These are antioxidants. They counter free radicals. These free radicals cause damage, supposedly. So when I started CoQ10, I started off with 200 milligrams, and then I worked my way up to about 400 or 600 milligrams. I'm not 100% sure. I started reaching a plateau where I was feeling quite good. I'd say like 50 to 60% better. My energy was significantly better, but I wasn't as energetic as I would have liked. So then I started taking ubiquinol. Ubiquinol is the active form of CoQ10, and it's about 6 times more potent. So 100 milligrams of ubiquinol is about the same as 600 milligrams of CoQ10, but it's more easily used by the body because it is active. After I was taking CoQ10 for about a year, I started taking ubiquinol. And at first I took 100 milligrams, and then a couple months later I started taking 200 milligrams. And that made me feel way more energized, and I was able to work a physical job almost full time, so it's pretty good. Although it didn't cure me, it did help with day-to-day functioning. Number 2, omega-369, or whatever combination of omegas that you want to take. CoQ10 and ubiquinol are fat-soluble supplements, so they absorb better into the body when taken with fat. So if you don't have a lot of fat in your diet, like avocados, coconut oil, butter, which isn't very good for you though, nuts, peanut butter, then you probably want to supplement with omegas. I take about 2 tablets per day. I was taking 4 tablets before, so read the label or ask your doctor. Number 3, L-lysine. So L-lysine, or just lysine, is an antiviral supplement specifically for human herpes virus or Epstein-Barr virus. So if you've had Epstein-Barr virus or monoglandular fever in the past, it's likely that you still have Epstein-Barr virus in your body. So this actually would be really beneficial for you. Number 4 is vitamin D. Vitamin D is really good for your immune system. I typically take about 4 drops per day, which I believe is 4,000 units. During winter, or if I'm around people who are really sick, I'll increase it up to 8 drops. And I notice that I don't get sick very much, whereas before I would get sick all the time. Number 5 is turmeric, and curcumin. These are anti-inflammatories, but you have to take them in a really large dose in order to notice a difference. I personally hated taking large doses of this, so I did it for a little while, noticed that it was pretty good. Number 6 is magnesium. It's really good for muscle pain. I find that I can get really random muscle pains that's kind of like in my joints, kind of burning feeling, or I'll get like shooting pains, like either down my arms or down my legs, or I'll get muscle cramping or like low-grade muscle twitching or fasciculations. So magnesium has really helped a lot with that. I take it before bed, try to take a couple hours before bed, and this actually reduces my muscle pain, so I'm actually able to sleep more. Number 7 is L-theanine or theanine. I'm not too sure how to pronounce this. This is an amino acid. It's usually found in specific green teas. This is the only thing that I noticed helped me with sleep when I was having a hard time falling asleep and staying asleep. I tried melatonin and that didn't really work for me, and I'm not really a fan of pharmaceutical sleeping drugs. So I definitely recommend this one. The only thing is that it kind of gave me a stomach ache, so I had to take it right before I was going to sleep. That way I could fall asleep before it kind of hurt my stomach. Number 8 is L-carnitine. This aids in muscle recovery, so a lot of bodybuilders use this after or before they go to the gym. I usually take this after work so that way I'm not too sore, but I have been going to the gym again, so I'm taking that as well after I go to the gym. I do believe you have to take L-carnitine with carbs, so keep that in mind. Here's some things that did not help for me. Licorice root, ginseng, astragalus, bromelain, cortisol manager, melatonin, golden seal. I did try ribose for a little bit. Some people claim that it really is helpful. That gave me a stomach ache as well, and so I decided to quit it, but a lot of people have mentioned that it worked for them, so maybe give that a try if you'd like. I also did get some general vitamin IVs and vitamin shots, and I found that those are not really helpful either. Okay, let's talk about IV therapies, which is my favorite part of this. I'm going to talk about 2 IV therapies. One is hydrogen peroxide IV, and another one is ozone IV, or also known as major auto hemotherapy. If you watched my previous video, which was an hour long, you'll hear me talk about it a bit, but I'm going to simplify it right now. So hydrogen peroxide IV contains 5 cc's or 5 milliliters of 3% medical grade hydrogen peroxide that's put into 500 cc's of a saline solution, so it's just a salt water. The IV is a slow drip over 90 minutes. So when the hydrogen peroxide comes into contact with blood, it reacts with the enzyme catalase and it produces water and oxygen. So the extra oxygen in your body it helps destroy anaerobic pathogens. So that's a fancy way of saying viruses, bacteria, things that shouldn't be in your body. They thrive in an environment that has little to no oxygen. So by increasing the oxygen in your body, you can potentially kill off the viruses and bacteria. Because I think my condition was caused by mono, my approach was to try to kill off any remaining Epstein-Barr virus. I found that this was pretty good. I had 5 treatments in total for hydrogen peroxide. I felt that it wasn't as aggressive as I needed because I had been ill for 7 or 8 years. This would maybe work better if you're recently become ill, or if you have, say, a cold or flu. I think this would help quite a bit. I did notice that my immune system got better with the hydrogen peroxide IV, but I didn't really notice any changes with ME. The next one, which is my favorite one, is the ozone therapy, major auto hemotherapy. So the doctor draws 60 milliliters of my blood into a syringe, and the syringe contains heparin, which is an anticoagulant. Basically, it's a drug that thins the blood out so that there's no blood clots in the syringe. Then he'll take that syringe, he'll inject it into a saline bag, and then in that bag with blood and saline, he'll inject 60 cc's of ozone. So usually it's done in 2 parts. There's an O2 machine and an oxygen machine, because O3 on its own is apparently quite unstable, so most people don't carry that. So this is a lot faster. This drip was over 30 minutes. So when the blood and ozone combine, the ozone basically cleans up the blood, and so there's no actual ozone or oxygen goes into your veins, so you don't have to worry about like embolism or getting air into your veins, which is pretty dangerous. It cleans your blood, so when you put the mixture back into your body, that clean blood will run through your body. The extra oxygen will help kill off viruses and bacteria, and it also helps kickstart your immune system as well. My doctor that I had this done with, he said he's used ozone therapy on patients with fibromyalgia, HIV, and even cancer, and he's seen good results with all of them, and he can now put me on the list because it worked really well for me too. Here's some other things that you can look into, but if you are a person with ME and you are on any sort of ME website or support group, you probably have heard of a few of these before. Mold exposure, chemical sensitivity. There's a few other things to note that might be affecting your health. Not necessarily causing ME, but it could be making it worse. So things like chronic infections, root canals. Root canals are actually very terrible for your health. They harbor a lot of bacteria because the roots is dead and so it's decaying and there's a lot of bacteria in there and it can spread through your body, and because it's so close to your brain it can actually affect your brain directly in most severe cases. So also infected teeth or wisdom teeth, those can cause infections in the body. And when you remove teeth, it's really important to make sure the dentist cleans out any ligaments or membranes that are remaining. Otherwise they could cause cavitations. So that's basically when the leftover tissue that wasn't cleaned out decays and causes infection and bacteria. Breast implants have been shown to cause similar symptoms to ME, both silicone and saline implants, because saline implants also have a silicone shell. IUDs, especially ones with silicone, such as Mirena or Skyla. Surgical implants, sometimes the joint material can be poisonous. Typically it's okay, but always, as always, do your research before you undergo surgery and make sure that the material that they're using is safe. Infected piercings or cheap jewelry that are interacting with your body, metal toxicity or mercury poisoning, and then any secondary conditions like depression, cancer, diabetes. These can worsen the symptoms even though it may not be the cause. So even though all of those other problems don't cause ME, they can still be contributing to it. I had 5 ozone IV treatments and I noticed a good improvement right away. I'd say at least I was at a 70%, and then a few months after all the IVs were done I was feeling about like 80 to maybe almost 90% better. And then I had my infected wisdom teeth taken out, and a few months after that I felt almost 100% better. It's definitely good to take a look at everything because your whole body works in one continuous unit. It's hard to isolate just a virus or just your teeth. Or also interesting to note, when I had infected wisdom teeth, I had really bad acne all over my jaw. I'll post some pictures here. And then a couple months after I got them taken out, my acne improved. See if you can see, I do have a couple pimples here and there because that's normal, but yeah. I hope you found this video helpful. If you have any other questions, just write down in the comments and I'll try to answer as much as I can. But of course, I'm not a doctor. This is all my own research, all my own experience. But hopefully this will give you some idea of how I've gotten almost 100% better and I'm able to do pretty much everything again. Guess that's all. Bye!